Arthritis. I have dealt with arthritis for the past 10 years with my mom. She's been dealing with it since she was about 30 years old, and it's been worse and worse. And I thought I'd share you some information on the type that she has. My mom, she has rheumatoid arthritis, and arthritis means inflammation in the joint. The inflammation causes redness, warmth, swelling, and pain within the joint. Rheumatoid arthritis affects joints on both sides of the body, such as both hands, both wrists, or both knees. This symmetry helps to set it apart from other types of arthritis. RA can also affect the skin, eyes, lungs, heart, blood, or nerves. The warning signs of RA are joint pain and swelling, stiffness, especially in the morning or after you sit for a long time. So as if with your hands, with my mom, she has it in her hands also, which means that your hands are slowly but surely stiffening. They go into a ball. Also, fatigue. Rheumatoid arthritis affects everyone differently. For some, joint symptoms develop gradually over several years, and others it may become quickly. Some people may have rheumatoid arthritis for a short time and then go into remission, which means they don't have symptoms. The immune system cells move from the blood into the joints and joint lining tissue called synovium. Once they arrive, those immune system cells create inflammation that leads to irritation, which wears down cartilage, the cushioning material at the end of the bones. As the cartilage wears down, space between the bones narrows. As it gets worse, the bones could rub against each other. So imagine a sponge in between these bones, and that sponge deteriorating over time. So once that sponge deteriorates, it's officially bone to bone. Inflammation of the joint lining causes swelling and makes fluid buildup within the joint. As the lining expands, it can also damage the bone. All of these things cause the joint to become very painful, swollen, and worn to the touch. Rheumatoid arthritis can be diagnosed from a combination of things, including the location of symmetry of painful joints, especially in the hand joints, joint stiffness in the morning, bumps and nodules under the skin, rheumatoid nodules, which are little balls underneath the skin. Results of X-ray and blood tests can also show that you have rheumatoid arthritis by the deterioration of the cartilage and your blood cells thinning. There are many treatments for arthritis. One of them is medication, rest, and exercise, and in some cases surgery to correct joint damage. The treatment will depend on several things, including your age, overall health, medical history, and how severe your case is. If you're taking medication, many rheumatoid arthritis medications can lower joint pain, swelling, and inflammation. Some of these drugs prevent or slow down the disease. Drugs that use joint pain, stiffness, and swelling include anti-inflammatory painkillers such as aspirin, ibuprofen, pain relievers that you put on your skin, and narcotic pain relievers. It is very important to be active, but you must pace yourself. During flare-ups, when joint inflammation gets worse, it's best to rest the joint. Using a cane or joint splints can help during flare-ups. So when the arthritis is in full-on mode, it's best to stay off your feet and not do a lot of work. When joint inflammation gets better, you need to exercise to keep your joints flexible and to strengthen the muscles that surround them. Low-impact activities such as brisk walking or swimming and gentle stretching can help. You may want to work with a physical therapist at first. Also, massage is a perfect way to to loosen up muscle stiffness. Swedish compression can also help. So if you have anyone that has arthritis, please help them. It's best to be informed and let them know and take care of it as quickly as possible.